Okay. Hi, everyone. I'm Christy Bird McKeeve, the Executive Director of Butte-Glenn Medical Society. And before we get started with the presentation, I just had a few quick reminders. Please keep yourself muted. You never know what's going to happen in your background. And even if it's faint and you can't really hear it, it might actually project loudly through the microphone. So please do so, and please keep muted until you are asked a question or asking a question. The chat feature is a great way to ask questions and to sort of get your, even if the Q&A goes live and there's a lot of questions, it's a great way to get your question heard. Sometimes it's hard to talk over one another. If you have technical difficulties, it sometimes helps to log off and sign back in, and that usually does the trick. We are recording this presentation and we'll be posting on the Butte-Glenn Medical Society YouTube channel. In a few seconds, I'm going to introduce our main speaker, but I just wanted to quickly say that Butte-Glenn Medical Society is distributing PPE. In fact, this afternoon, you may see behind me some boxes. We have one last donation to distribute. I'm a little surprised at how quickly when I do the call out that I have PPE to share, how quickly people are responding. And want to note that the California Medical Association will soon have a website. They just were testing a pilot in a different county, and will be sharing that link with us soon. And that will enable everyone to order PPE directly from CMA and have it delivered to you with better ability to choose and select what you want of the PPE. I also want to note that gloves are in short supply, mainly because many people are holding on to them for the vaccine distribution sites. So just FYI, that's what I'm seeing in all of our PPE efforts. We have been connecting information to everyone in Butte, Glenn, and Tehama counties since the pandemic started almost a year ago. And that is one of our great roles, is making sure that physicians everywhere have the information that they need to know, and their practice staff as well. So if you have any other ways that you think that Butte-Glenn Medical Society can help, please let me know. I'm the only staff person, but my PPE distribution hat will be moving over to the California Medical Association shortly, so I will have some more bandwidth to help in other ways. Just let me know. Part of what we've done is we've printed these stickers. They say, "I got my COVID-19 vaccine," and have already shared those with the county and another main distribution site. And that's a way of us helping to encourage everyone to be vaccinated when it is their turn. We also have a video with two physicians talking for about 20 minutes about the concerns that they're hearing about the vaccine and what they're, just trying to share the information so that misinformation doesn't get spread through the community. And so that's what I wanted to say about our medical community working together. We will have some virtual grand rounds scheduled in February specifically for COVID-19, and I'm just trying to get that schedule pinned down, and we'll have that out shortly. So now I want to introduce Elena Reyes and Eunice Lopez of Public Health, Butte County. They're going to share what they've been doing since mid-December and through the holidays. I just want to say how thankful I am for the work that they do, because it just seems like a monumental task. And it continues to change and transition. So I know it's been challenging, and they handle it with grace, and so appreciate that. So let me go on to stop sharing my slides so that you can share yours.
Thanks so much for having us, Christy. Sorry, it took a while to get the screen up.
Wonderful. Well, as Lena said, thank you so much. We're happy to be here to present. We're hoping to provide you with a high level but concise presentation of the work that we have been doing, like Christy said, since December. If you have any questions, please hold on those until the end of the presentation. We do have plenty of time to answer any that arise. Next slide, please. So if you've visited our website in the last couple of weeks, you've probably noticed this really handy graphic that shows exactly which phases and tiers we have managed to work our way through. We have been very fortunate in our county to be able to quickly but efficiently work our way through the entire phase 1A, tiers 1, 2, and 3, which includes all of our healthcare professionals. You'll notice on the left-hand side, it says "You missed me" form. So if you or someone that you know identifies as belonging to any of those sectors in phase 1A, tiers 1, 2, or 3, but were not invited to get vaccinated as of yet, then we would love to direct them to our COVID vaccine website. You'll see the link for it at the bottom of the slide. On that site, you'll find a form that says "You missed me," and that's where they can email us at that email address and let us know that, hey, I actually was in phase 1A, tier 2, you missed me, how can I get vaccinated? So if you have any colleagues, family, or friends who fall into that category, then please direct them to our website and they can receive messages from us directly. As you can see, we are currently working in phase 1B. We have recently sent out invitations to our community members who are in the 75 plus age category to attend various clinics hosted by Enloe Hospital as well as Oroville Hospital. Orchard Hospital is also taking care of some of their clients who are 75 and older. In order to be notified of when it is your turn to be vaccinated, on that same website that I mentioned below, there's an individual notification registration form. We are asking that our community members who fall into these next phases and tiers do sign up to be registered to be notified. It is the easiest way for us to find out who you are, which sector you fall into, and to send an email to you inviting you to get vaccinated. There is also a form there for employers and organizations. Instead of submitting individual forms, you can just submit one form that covers all of your employees. So those are some options there. You'll notice that phase 1B does include a couple of tiers. I will let you know that as of right now, we have received guidance from the state to continue with completing tier 1 of phase 1B, but we are going to pause on tier 2 until further notice. We can discuss that more at the end of this presentation and kind of what that looks like. Next slide, please. This is an example of that individual form that's on our website. So you would indicate the industry or sector that you fall into. You provide some contact information and then answer a couple of questions regarding medical conditions. When you submit that form, it comes to us via email, and then we notify you of when it's your time to get vaccinated. Very easy, user-friendly, and it is available, I believe, in English, Spanish, and soon to be also in Hmong. Next slide.
So this is a screenshot actually from the website. This week on the COVID-19 page, you can see at the bottom the dashboard that shows all the current information for the COVID-19 response in Butte County. Also now includes a slide on vaccine status. We're hoping to update this weekly with the updates on the total allocations for Butte County, how much has been received, as well as ordered and administered. So there's a lot of numbers here, and we thought we'd take this opportunity to break down what exactly that means, just because you know, we've been told that Butte County has been allocated vaccine doesn't mean necessarily that's a quick through line directly to people. There are a number of stages from originating from the federal government to the state government and then into Butte County. So the first stage is California allocates vaccine to Butte County. Butte County is then able to order vaccine for approved providers of the COVID-19 vaccine. So that's what those ordered doses referred to. And we've split those up in between first and second doses for clarity, because, for example, this number 41,975 at the top doesn't necessarily mean that we can vaccinate 41,975 people when we've received 30,000 for first doses, and then the rest is for second doses. Received refers to doses that have successfully been ordered and delivered and are on site at locations. I referred a little earlier to administered vaccines and the trouble with estimating the true number of administered vaccines. Statewide, we've been hearing about some data issues and technical issues, and we're estimating that to be higher, but are not entirely sure where that's at. Some of our partners are working through technical issues with the immunization registry system as well. And then also to clarify, because that number 30,000 and 11,000, that can sound like a really big difference. But every week we've been ordering slightly more vaccine as our capacity county-wide ramps up. So we have a little note here at the bottom clarifying that the order made on 1/16 this year was our largest order to date. Nearly 16,000 first doses and 4,000 second doses. So those arrived in Butte County last week and are currently being distributed and administered. So most of those administered doses are not yet in that 11,000 number, in combination with some lags with data and some other issues at play. But this slide will be updated weekly as we can, optimally on Thursdays, and that is in the main dashboard for the COVID-19 updates. So we did say we can give some guidance as far as what you can do, how you can become involved, how you can help. You can volunteer, as mentioned earlier. So we're going to direct anyone and everyone, regardless of which county you're in, because of course, these updates that we're giving on doses and administrations are specifically just for Butte County. We can't speak to Glenn County, but anyone can register for healthcarevolunteers.ca.gov in whatever capacity. Speaking for Butte County, we're going to be accessing that list as much as possible to fill as many different kinds of roles as possible, including people to assist with scheduling. Maybe you're not clinically active, screeners, taking temperature and screening for symptoms, logistics flow, including vaccinators and observers. As a reminder, there is a requirement of an observation time of 15 minutes, minimum of 15 to 20 minutes for both the Pfizer and Moderna options. The other way you can help is becoming a provider of the COVID-19 vaccine yourself. In the early phases of vaccine distribution, this was by invite only and was limited mainly to providers who would be directly immunizing phase 1A populations. So immunizers who would be immunizing healthcare personnel. This is now open as much as possible. The link is right here. It is also on the COVID-19 vaccine webpage, and can also link you to more resources such as EasyIZ for more information about the reporting, storage, and training requirements. These are also in the CalVax portal, which is where one goes to apply to become a provider. So once that application is submitted, it does require state approval to process and approve that application before one can receive vaccine from the county allocation. And we do have staff who are able to answer your questions and provide assistance and guidance through that application process. And not everyone is maybe in a space where they're set up to be a provider. There are cold storage requirements, and sometimes you're maybe in a smaller physical office space that's not conducive to vaccinating large numbers of people, but you still want to help. I would say I would direct those kinds of those people in those contexts to healthcarevolunteers.ca.gov, especially groups who are who have been also authorized to immunize with the vaccine, such as dentists and EMTs. And I see a question from Christy about how many providers have been approved and how long it takes on average to get approved. We have under a dozen. I believe the number is 9 or 10 right now. It does change day by day. And the time it takes to get approved really does vary by application. Some are really fast. If all of the information is in there and they can process it well and quickly, it can go quickly. Sometimes CDPH has to come back and make some inquiries or ask for more information to fill in. Here we go. And of course, we want to thank you for your ongoing support and patience. It can be really difficult to stay fluid and dynamic. The situation is constantly changing, and sometimes it's not easy to capture everything that's going on in a simple statement or in a small media press. And speaking of the media, I thought I'd mention a little transparency regarding our allocations. The first coverage of our allocations made it sound like our allocation was rather big, and our first one was our largest to date, and since then it's been consistently much smaller, which is why we included this table to give a little perspective as far as how much vaccine is actually coming into Butte County. So the column I'd like to draw your attention to is that second column, the first dose allocation. This is really all new people that we are able to vaccinate in Butte County, as those second doses are then dedicated to the people who got their first doses either 3 or 4 weeks earlier. And then on the right column, we have this week's total allocation. For this week, we have TBD for first dose allocation because we have not been, we have not received our first dose allocation this week. It can be really difficult to plan for future clinics when we don't know what's coming this week. And that's the case not only at a county level, but also at a state level as well. So we're trying to communicate as much as possible and be transparent as much as possible, even given the limitations that we're facing. And this would be a great time to answer some questions that you have. We've also listed additional resources to answer vaccine questions as well as application questions. We have the COVID call center as well as the CalVax tech assistance emails and phone numbers right here as well.
Thank you for that. I think there was a question in the chat about vaccine at Safeway, Walgreens, Walmart, Costco, and private offices in Butte County.
So all of those locations, any pharmaceutical provider or private office, all must apply to become a provider of the COVID-19 vaccine, regardless of the context. It's a federal agreement, although it's negotiated through the state, and the state kind of mediates that process, but all must do that.
So Safeway is approved, I heard. Is that true?
Safeway is approved and is currently conducting some closed clinics in accordance with the tiered system, and are also working with us on some more specific focused closed clinics.
So would you still encourage providers to keep enrolling? Is the ultimate goal to have as many different community providers as possible, or what is the vision for going forward?
Our hope is for residents of Butte County to be able to access vaccine in the context in which they're familiar. So that would include their primary care offices. And of course, we're trying to stay fluid and dynamic and keep up with the guidance that CDPH gives us as well.
And so you said this, you mentioned this earlier, but just to clarify, you think one of the biggest limitations for a community provider to enroll would be whether they have cold storage capabilities?
That's not the only limitation, and to be clear, one does not have to have an ultra low temperature freezer in order to be a provider. So we can dispel some misinformation, and some of the information in this information is one does not have to have an ultra low temperature freezer to be a provider. Not everyone has the ability to store and administer the Pfizer vaccine, and in primary care settings, as well as most non-hospital settings, the Moderna and other vaccine, upcoming vaccine candidates would be a better fit and would not require ultra low temperature storage.
So to the best of your knowledge, would you say that the new state system through calvax.org which is supposed to have a sort of general public sign up available sometime soon? They're still working on that technology from what I understand. Is that something that you're going to adopt for Butte County, or are you going to stick with the very easy, it seems like a very easy system that Butte County has already created? Just curious.
We're hoping for whatever is going to work best for the residents of Butte County, in whichever form that's going to take. The CalVax is going to be a very big system. It's supposed to have a provider and a patient end, as well as an LHD end, and all of those pieces are active and live yet. So we'll see and evaluate and do what we can.
Gotcha. Yeah, it does seem like a vast undertaking, and just thankful that in December, when vaccines were available, you all responded and just set up shop, and it looks like a great system, because it's going to take a little while, I think, for the state's system to get in place.
Absolutely, and of course, it didn't just start in December. It did take a couple months of advanced preparation, and we try and mention all the time that most of the successes in Butte County are really due to the tight partnerships with our providers in Butte County, and especially our tight partnerships with the hospitals who have made this rollout really efficient, and we're really thankful for this community.
Yeah. It is an awesome community. So does anybody have any questions? Dr. Stone, Dr. Matthews?
I have questions. Can we do it online, or do we have to do it in messages?
Oh, you can speak it now.
Okay. So the question I have is, I sent in an application or went online for the California Department of Health. And the first question they ask is, which one do you want to do? And every time I've done that, it doesn't allow me to put an answer. So the rest of the application that I put in, they won't accept it till I put something in that box. So I was trying to find somebody who'd be able to help with that or put in the application. And I don't know how to do that.
Could you clarify which form that was?
It's the form for the provider of medical health emergency volunteer.
So maybe calling the 1-833 number that's in the middle of this slide.
Okay, I wrote that down, or I took a picture of it. And then the other one, I know that we're counting how many people have received it. Counting of those doses that were wasted because we didn't have anybody to put it into their arm.
I haven't really seen a lot of that in Butte County. I have heard of it being an issue in other counties and other states, but here that number is quite small.
Okay, because I was wondering what mechanism you have that if you have doses left over, but your registrations have been filled, how do you use the end of the doses so that they're not wasted?
Yeah, that's going to be a kind of site by site decision on those mechanisms. For example, we talked a little bit about closed clinics, and one of the mechanisms there is to book in cases where they're using Moderna in 10 dose blocks. so that you know that you're not wasting any doses. And some sites will maybe call their upcoming appointments if they do find they have extra doses. So there are those kinds of systems in place, and they're going to vary by the site and what they're capable of and what their system flow is.
Sure. And then the other one is, are there going to be mobile units for migrant workers and anybody that's out in the field or in rural areas?
You're asking the really good questions, and those are items that are in planning motions as we speak.
Okay. And the last one is, I know that elderly people don't have telephones or electronic mechanisms to do it, and they may be part of that 75 or older group. How are we going to capture those people?
So when we're talking about the forms that require an email, some of the guidance has been to kind of pull assistance from friends and family who may be able to assist with that connection. But access will definitely be expanded as supplies expanded. Our major concern is we don't want our elders to be waiting in line for hours, either waiting to make an appointment or waiting to get vaccine in a potentially crowded situation. I know my grandmother would physically not be able to handle that, and we definitely don't wish any of that upon any of our elders here in Butte County either.
Have you gone out to any of the churches or other community groups that might be able to assist with that?
That is a great idea. We'll take that back.
Might it also be that as community providers come online, then they have hopefully ways to communicate with their patients, and that can assist with communications? Okay, well, there's another question from Dr. Stone in the chat. Does anyone in Butte County have, I can't say that word, Dr. Stone, bamlanivimab or any other therapy? This is why I'm not a doctor.
Oh, that's a great question.
Maybe
My
you can-
sister received that when she got a positive COVID. She's in a healthcare facility right now. And they told her that she can't get her vaccination until 90 days after she's had the bamlanivimab. Is that the case? Is that the literature?
Dr. Bernstein, I think that's a question for you.
Yeah.
Apologies, one more time. What's the question, Joe?
The bamlanivimab, the status of bamlanivimab in Butte County and guidance on getting vaccine, the time after which one has received bamlanivimab that one can receive vaccine.
Oh.
Yeah, my sister received it and probably saved her life. She had very mild symptoms, and she has diabetes, high blood pressure, obesity, pulmonary problems. She had all of those, and she made it through with the bamlanivimab. But the question now is that they're injecting the first doses of them Moderna, but she's not qualified because they say she has to be out 90 days from the injection of the monoclonal antibody. And I just wanted to know the literature.
Thanks for asking that question. 90 days sounds long, but I was just looking through the CDC website on clinical guidance for clinicians. And I don't remember, I remember specifically that the topic of vaccination following monoclonal antibody receipt is there, but I don't remember the exact time frame. Do you have access to?
I know CVS is the organization that is running the facilities in Chico, but I didn't know of any literature that supported that. I didn't know if the monoclonal antibody takes 90 days to get out of your body so that it doesn't affect the immunization with the vaccination, or where they're getting that literature.
Yeah, hi, this is Linda Lewis, and I've actually had some experience with this, especially with our skilled nursing facilities and with Enlo. And yes, it is recommended to wait 90 days. There's two factors there. One is that people who have been recently infected are not at high risk of becoming reinfected within that 90-day period. And the second is that because the monoclonal antibodies may interfere with the person mounting their own immune response. So there is a recommendation to wait 90 days after administration of monoclonal antibodies. The other question was, where is this given? And some of the skilled nursing facilities are administering it, and Enlo has quite a robust program to make it available to people other than their patients. And then Oroville Hospital, I think, is using in-house, but they aren't set up for outpatient administration, or at least last I checked.
Well, she's at Windsor, and they have had at least 6 or 7 people get the IV injection at their facility, and 5 have had to go to Enloe Hospital because of their symptoms. But so there are at least 6 or 7 people over at Windsor that are not receiving the vaccination, which was day before yesterday, because of the monoclonal antibodies. So
Yeah,
I just was trying to get the literature to support that.
The website, the CDC website on clinical recommendations gets updated regularly, Joseph. I would suggest, just Googling CDC clinical recommendations for COVID vaccine.
Okay. That's easy to do.
Thanks, Linda, for weighing in. I was going to pull that up.
yeah, no
And
problem.
then what I need to do is fill out that application for CDPH to be able to volunteer.
What you mentioned earlier about not being able to enter the choices is a little bit disturbing.
It is, and I don't know who else is having trouble, but they have no place where it says contact us to try to get that taken care of. So I'll call this phone number and see if that helps.
Okay, and I may try to pull up that form and enter the information as well, see what
Okay.
happens.
And then I put my email address
Got it.
on it.
Did you get that, Elena? Dr. Matthews' email address from the chat?
Yes.
Okay.
So Dr. Bernstein, you said you had a slide about the variance. If there are no other questions, we can do that slide. What does everybody think?
Yeah, sounds great.
Am I allowed to share? I don't have permission to share yet.
You should.
Oh, okay, there we go.
Okay, good.
All right, and sharing. Can you see? I don't like that black bar. Oops.
Yeah.
I don't like the black bar at the top, but
Yeah, the only way you can get that to stop is to go below it, and then it'll pull back up, and then you go quickly to where you need to be.
all right, well, let me just see if I can operate from, most of the information is available. Can you see my cursor moving around?
Yes, we can.
So there are 4 points here. The Centers for Disease Control has estimated that the UK variant will become the dominant strain in the US and may very well be the dominant strain in California earlier than March. It seems to spread substantially faster than the wild type SARS-CoV-2. And that's apparently the case among both adults and children. The other interesting development is that in the UK, the group called the New and Emerging Respiratory Virus Threats Advisory Group, NERVTAG, filed a report with the World Health Organization's Strategic Advisory Group of Experts, or SAGE. That's a group that CDC usually has representation on, and it's a well-regarded group. And the report that they filed with them includes analyses from 3 or 4 of the UK's top university epidemiologists who've reviewed the data that are available from observational studies or cohort studies. And the data that they have been able to review appears to indicate that not only does this UK variant B117 appear to be more easily transmitted, but there is at least preliminary evidence that it may very well have a higher case fatality rate, be more potentially more cause more severe or more likely to be fatal outcome. But on this slide, I've underlined and bolded the bottom line, which is that regardless of whether you've already begun receiving vaccinations or completed 2 doses, or you're waiting for vaccination, we still need to adhere to the non-pharmaceutical interventions that we know are quite effective if they are followed comprehensively and individually. So that's the purpose of this slide. And there are some references here that you could check out, including the NERVTAG report. So far as I know, the CDC has not acted upon the analyses carried out by the UK groups, but I guess that will happen in the near future.
Has this spread beyond the UK? I mean, I know it's in the US, but are all the other countries on the globe also seeing this now? Yeah.
A number of countries are seeing the UK variant, and of course there's other variants appearing as well. Another point, and one of the reasons for the bolded underlining bottom line, is that variants occur in proportion to the frequency of transmission of the virus, the wild type virus, if you will. So the more transmission that's taking place in a given country, and the US unfortunately is doing, what shall I say, much better or much worse in that area than most other countries. As a result of the frequency and spread of transmission in the US, the likelihood of variants occurring and spreading here is greater than it might otherwise be.
Okay, any questions for Dr. Bob?
I'll stop sharing.
Okay. I just see that Elena and Eunice have a 1 o'clock meeting, so they jumped off, or Eunice is still there. But anyway, people have a 1 o'clock meeting, so we can wrap this up unless there's other questions. Of course, feel free to email me. I'm at bgmsed@gmail.com, and a lot of the information that we have been sharing with the California Medical Association is moving into the state so that they can better streamline different processes, especially for getting providers enrolled into the process. So we're a conduit of information, a voice locally up to the state too. Of course, you are as well in public health. So working together is a good thing. So thank you for this. And maybe in February, Dr. Bernstein, when we get our virtual grand round scheduled with you, the variant one will be an interesting, bigger topic, and you may have more details by then, perhaps.
I'm sure they'll keep changing.
Every day.
Yeah. Thanks for organizing this, Christy, and thanks to Eunice and Elena for their presentations.
It's a monumental undertaking and very much appreciated by everybody. All right, well, thanks so much. You all have a good rest of your day. I'm going to deliver some PPE.
Okay, good. Bye-bye.
All right, bye-bye.